You're a repeat participant at the International Course on ECMO. What attracts you to this event?
Well, the International Course on ECMO is definitely one of the premier critical care and ECMO courses in the world.
Can you tell us a little bit more about the ECMONet initiative?
Sure. The International ECMO Network is an organization dedicated to fostering high-quality, high-impact clinical research in the fields of ECMO and extracorporeal CO2 removal.
And what are some of the initial initiatives? What are some of the activities that the ECMONet is going to be undertaking?
The main activities are clinical trials in ECMO, as well as consensus statements, position papers that we hope to publish in the coming months.
And is there what was the reason for setting up the organisation? Is there what was the particular need for ECMONet?
ECMONet really started because we have a need in the world today for centers who do a small volume of ECMO patients but do high quality ECMO to come together to do larger studies that can have more important outcomes looked at.
What are the important issues that we need to hear more about in these kinds of programs?
Well, right now in the field of ECMO, adult ECMO is surging, whereas neonatal and pediatric ECMO are staying more or less stable in terms of the numbers of cases being done. In adult ECMO, there are two areas that are growing the fastest, so adult respiratory failure and adult extracorporeal CPR. So I think most of our focus has been recently on those two areas, with a particular focus for the respiratory failure on CO2 removal. We see that as probably the future for ECMO, because ECMO itself, oxygenating patients, is likely to be reserved for a much smaller population of patients and is much more complex to perform, so it's generally done in very specialized centers, whereas one can envision in the future seeing CO2 removal performed at many hospitals, even hospitals that are currently less skilled in extracorporeal technology, but we're a little ways off from that. So I think the ECMO course will begin to address where we're going in the future and how that might be the direction that we're going.
Thanks very much, Dr. Brodie.